Hi, my name is Jennifer Bash, Coding Manager for Comprehensive Medical Data Management, Inc. I'd like to give you an overview of diagnostic and interventional breast imaging coding. Billing guidelines. Medicare reimbursement for diagnostic imaging procedures is comprised of a professional component, technical component, and a global reimbursement. The professional component is the amount paid to the physician for the interpretation. The technical component is the amount paid for all other services, including staffing, equipment, and overhead. The global reimbursement is a combination of professional and technical component when paid to the same individual or entity. Currently, reimbursement for diagnostic imaging is based on the site of care. For independent diagnostic testing facilities, or IDTFs, and physician offices, professional and technical components are reimbursed based on the Medicare Physician Fee Schedule. For hospital outpatients, professional component is reimbursed under the Medicare Physician Fee Schedule, and technical component is reimbursed under an ambulatory payment classification, or APC, under Medicare's Hospital Outpatient Prospective Payment System, or HOPS. For hospital inpatients, professional component is reimbursed under the Medicare Physician Fee Schedule, and the technical component is grouped within the payment to the hospital that is determined based on the DRG, or diagnosis-related group. Diagnostic Breast MRI CPT codes. 77058 is for unilateral breast MRI. 77059 is for bilateral breast MRI. 0159T is for CAD in conjunction with breast MRI. 0159T is a Category 3 code, computer-aided detection including computer algorithm analysis of MRI image data for lesion detection, characterization, pharmacokinetic analysis with further physician review for interpretation, breast MRI. This should be reported only as an add-on code to 77058 or 77059. Per the American College of Radiology, 3D reconstructions, subtraction, and angiodynamic assessment performed in conjunction with CAD are included in the 0159T and are not to be reported separately. What is a Category 3 code? Category 3 codes are temporary codes used for emerging technology, services, and procedures that will allow data collection. If a Category 3 code exists, it must be reported. Medicare typically will not reimburse Category 3 codes. Some third-party carriers may provide reimbursement. Hospital pass-through codes. The following codes represent new technology services and should be reported utilizing APCs by hospitals' outpatient facilities under HOPS. Our focus is on physician billing. Please refer to your state regulations for hospital billing details. Key documentation. What was done? Was contrast used? If so, were images acquired both pre- and post-contrast administration? What type of contrast was used? How much was administered? Was the procedure unilateral or bilateral? Was CAD implemented? What were the significant findings? The signed radiology report is the primary legal document to support services rendered. Here we have provided some examples for codes 77058, 77059, and 0159T. The following are possible CPT codes that can be used when performing an MRI-guided breast biopsy. Obviously, you must be able to justify each of these codes. 77058 and 77059 are for the initial diagnostic breast MRI. It is usually a unilateral procedure. 77021 is for the MR guidance. 19103 is for the vacuum-assisted breast biopsy. 19295 is for a clip placement. 76098 is for specimen radiograph. And 19290 is for preoperative placement of a needle localization wire. Key documentation for the biopsy. What was done? Was an additional diagnostic breast MRI performed on the day of the biopsy? And if so, follow normal documentation guidelines for breast MRI. Was a localization needle placed prior to the biopsy? If so, this should be documented on a separate radiology report. Was the biopsy done with vacuum assistance? What type of imaging guidance was utilized for the biopsy? Was a marker clip placed? Was a specimen radiograph performed? How many lesions were sampled? And what were the significant findings? Again, the signed radiology report is the primary legal document to support services rendered. Here you can see examples for multiple biopsy codes. Here's an example of biopsy dictation. You can find this in the Documents section if you wish to print it. Reimbursement for breast MRI. The average Medicare reimbursement nationally for the professional component for 77058, $85. For 77059, also $85. 0159T is $0, as Medicare typically will not reimburse Category 3 codes. Reimbursement for MRI-guided breast biopsies. The average Medicare reimbursement nationally for the professional component and facility reimbursement for 77058, $85. 77021 is $80. 19103, $191. 19295, $93. 76098, $8. 19290, $64. Medical necessity. While all states vary, the following are a few diagnoses that are generally considered medically necessary nationwide for breast MRI. Malignant neoplasm of the female breast, benign neoplasm of the breast, carcinoma in situ of the breast cyst, fibrocystic breast disease, mammary duct ectasia, inflammatory breast disease, breast hypertrophy, breast atrophy, mammographic microcalcifications, and other abnormal mammogram. Many of these diagnoses also require an inconclusive mammogram prior to the MRI. I have listed for you websites where you can obtain additional information. Thank you.